There are moments in life that arrive without warning, without noise, without any visible sign that something life-changing is already in motion, quietly unfolding beneath the surface while the world continues as if nothing is wrong, and the thought that something so powerful, so final, and so deeply personal could be moving closer with each passing second is enough to send a chill through anyone who stops long enough to consider it, because somewhere, right now, someone is laughing with their family, someone is finishing a long day at work, someone is driving home thinking about tomorrow, completely unaware that their life may be standing on the edge of a moment that will divide everything into before and after. It is terrifying to realize how fragile time really is, how quickly a normal day can turn into a memory that people replay in their minds again and again, wondering if there was a moment they missed, a silent signal they didn't notice, a feeling they brushed aside because it seemed too small to matter. The truth is, this is not a distant danger that belongs only in hospitals or headlines. It is something that lives quietly in the background of everyday life, close enough to touch every home, every family, every age, and every routine. And the most unsettling part is not the suddenness, but the silence, the way life can appear perfectly ordinary until, in a single instant, everything changes. Imagine sitting in a room full of people, surrounded by noise, conversations, and warmth, yet somewhere deep inside, something critical begins to shift without permission, without announcement, without giving you time to prepare. It's the kind of thought that makes you pause, that makes you look inward, that makes you question how well you truly know your own body and how often you ignore what it tries to tell you. Many people believe they have time, that serious things happen to someone else, somewhere else, at some other point in life. But reality doesn't always follow those expectations. There are stories of strong individuals, careful individuals, ordinary individuals who believed they were just fine, who never imagined that their day would end differently than it began. And when you start to think about how many lives have been touched, how many families have been shaken, how many conversations have been left unfinished, a quiet fear settles in, the kind that doesn't scream but lingers in the back of your mind, asking a simple but heavy question. What if? What if something inside you is already closer than you think? What if that feeling of, "I'm probably fine," is just a comforting thought you tell yourself because it's easier than facing the unknown? The human heart has always been seen as a symbol of strength, love, and endurance, beating faithfully from the first moment of life, carrying every memory, every emotion, every experience. Yet the very thing that keeps us alive is also something we rarely think about until we're forced to. And that is what makes this subject so deeply unsettling, because it reminds us that life is not guaranteed, that normal moments are precious, and that sometimes the most serious dangers don't arrive with loud warnings but with quiet, unnoticed changes that happen while we're busy living. As you listen to this, it's natural to feel a sense of concern, a pull of curiosity, even a hint of fear, because the possibility feels personal, not distant, not abstract, but close enough to make you wonder about your own life, your own future, and whether you might be ignoring something important without even realizing it. A heart attack, also called a myocardial infarction, is a serious condition that happens when the blood flow to a part of your heart becomes blocked. Think of your heart as a powerful engine that never stops working, day and night, pumping blood to every part of your body. For your heart to keep beating and doing its job, it needs a constant supply of oxygen-rich blood delivered through special blood vessels called coronary arteries. Now, if one of these arteries becomes narrowed or suddenly blocked, the heart muscle in that area doesn't get enough oxygen and it begins to get damaged. This damage is what we call a heart attack. It can happen slowly, over time, or it can strike suddenly, catching people completely off guard. Even if someone feels generally healthy, this condition can develop quietly in the background because the heart often struggles silently before it gives any warning that something serious is about to happen. The intensity and severity of a heart attack can vary, but the underlying danger is the same. If the heart muscle cannot get the oxygen it needs, it starts to die, and the longer it goes without blood, the greater the damage. It's like a fire slowly spreading inside an engine, quietly weakening its parts until the engine can no longer function properly. Many people don't realize that the body sends signals that something is wrong, but these signs can be subtle and easy to miss, which is why understanding what a heart attack truly is can make all the difference. It's not just about sudden chest pain or dramatic emergencies you see on television. It's about understanding that the heart is incredibly strong, but also incredibly vulnerable, and even one moment of blocked blood flow can change a life forever. Learning about this disease isn't meant to scare you, but to help you respect the power and fragility of your heart, and to understand that knowing how it works and what can go wrong is the first step toward protecting it. Awareness is the bridge between living carelessly and living with intention, because when it comes to the heart, even a few seconds can matter. By grasping what a heart attack truly is, you can begin to recognize the early whispers of danger, understand how it affects your body, and take your health more seriously than ever before. It's a reminder that every heartbeat counts, every choice matters, and being informed is not just knowledge, it's a tool for life. And as you reflect on this, remember that understanding the nature of a heart attack is not about fear, but about respect for your body, a reminder to pay attention, to act wisely, and to value the life that beats steadily within you. Even now, as you hear this, the heart inside you is working tirelessly, and treating it with care is the most important commitment you can make to yourself and to those who love you. Take a moment to honor that work, and let this knowledge guide your next steps in protecting your life and health. When we talk about the causes of a heart attack, it's important to understand that it is rarely caused by a single factor. The heart is affected by so many aspects of our daily life, from what we eat, how much we move, how we handle stress, and even how our bodies process cholesterol and fat. One of the most common causes is a buildup of a fatty substance called plaque inside the walls of the arteries that supply blood to the heart. Over time, this plaque can harden or rupture, creating a blockage that prevents blood from reaching the heart muscle. Imagine a river that slowly becomes clogged with debris. Eventually, the flow of water is blocked, and everything downstream suffers. Similarly, when blood can't reach a part of your heart, that tissue begins to starve, and the damage begins. Another significant cause is a sudden spasm in the coronary artery, which can temporarily tighten or close off the vessel, stopping blood flow even without plaque buildup. This can happen in response to extreme stress, intense physical exertion, or certain substances like tobacco or drugs. High blood pressure is also a silent contributor, as it strains the walls of arteries over time, making them more vulnerable to damage and blockages. Diabetes plays a role too, because high blood sugar can affect both the blood vessels and the heart's ability to handle stress, quietly increasing the risk without obvious warning signs. Lifestyle factors like smoking, lack of physical activity, poor diet, and chronic stress are all intertwined with these medical conditions, creating a chain reaction that can lead to a heart attack. Age and family history are also important, as some people inherit a predisposition for heart disease, meaning their arteries may be more prone to plaque buildup or other weaknesses. It's not about blaming yourself, but about understanding that the heart is sensitive to both the choices we make and the genetic hand we're dealt. Even someone who feels completely healthy could be at risk if underlying factors are silently affecting the heart. That's why education, awareness, and regular checkups are so vital. They allow you to recognize and address risk factors before they become emergencies. It's also why lifestyle adjustments, even small ones, can have a profound effect over time, because each step toward better nutrition, regular movement, stress management, and healthy habits is a step toward protecting your heart from the hidden threats that build slowly but relentlessly. Understanding the causes of a heart attack is not meant to overwhelm or frighten you, but to give you knowledge and power over your own life. When you see the heart not just as an organ, but as a living, beating engine that responds to every choice you make, it becomes clear that the causes of heart attacks are not mysteries. They are signals, reminders, and opportunities to act. And as you absorb this, remember that awareness is your first line of defense. By understanding what can put your heart at risk, you are already taking steps to care for it, to honor the life it sustains, and to protect the moments and people that matter most to you. Your heart works for you every second of every day, and knowing what threatens it gives you the chance to work for it in return. When it comes to understanding the symptoms of a heart attack, it's important to recognize that they are not always as obvious as we might think, and they can vary greatly from person to person. Many people imagine a heart attack as a sudden crushing chest pain, but in reality, it can present in ways that are subtle, confusing, or easy to dismiss. Some people experience a tightness or pressure in the chest, almost like a heavy weight pressing down, while others may feel discomfort that spreads to the shoulders, arms, back, neck, or jaw. There can be a sense of fullness or squeezing, sometimes accompanied by a burning sensation that doesn't go away with rest and seems different from ordinary heartburn or muscle strain. But chest discomfort is just one piece of the puzzle. Many people also experience shortness of breath, even when they are sitting still, or feel unusually tired without explanation, as if every action takes more energy than it should. Sweating, sometimes cold and clammy, nausea, Dizziness or lightheadedness can also appear, signaling that the heart is under stress. Women, older adults, and people with diabetes may experience symptoms that are even less obvious, such as unusual fatigue, mild discomfort, indigestion-like feelings, or simply a sense that something is wrong without knowing why. This makes it easy to ignore early warnings, to convince yourself that it's nothing serious, or to chalk it up to stress or a busy day. Yet each of these signals is your body's way of alerting you that the heart is not getting the blood and oxygen it needs, and every moment of hesitation can increase the risk of permanent damage. The key is to pay attention to patterns and changes that feel out of the ordinary for your body. If you notice persistent discomfort, sudden shortness of breath, extreme fatigue, or any combination of these symptoms, it's critical to act immediately and seek help. Understanding the range of possible symptoms is empowering because it helps you recognize when something is wrong, even if it doesn't fit the dramatic image you might have in your mind. Early recognition saves lives, and knowing that these warning signs can be subtle emphasizes the importance of trusting your instincts about your own body, listening closely to how your body feels, noticing differences from your usual energy levels or comfort, and taking those feelings seriously can be the difference between a minor heart injury and a life-threatening event. As you absorb this information, remember that paying attention to symptoms is not about fear. It's about awareness, protection, and care. Your body communicates constantly, and by learning to recognize the signs of a heart attack, you give yourself the greatest gift, the chance to act in time, to preserve your heart, and to protect the life you are living and the people who depend on you. Take a deep breath, commit to listening to your body, and let this awareness guide you toward taking every precaution you can to keep your heart safe. When it comes to the treatment of a heart attack, it is critical to understand that every second counts, and acting quickly can save both heart muscle and life itself. Treatment is designed to restore blood flow to the heart as fast as possible, reduce damage, and prevent complications, and it often begins the moment someone experiences symptoms. In a hospital setting, doctors use a combination of medications and procedures tailored to the individual's condition. Medications may include drugs that dissolve blood clots, help the blood flow more easily, reduce strain on the heart, or control heart rhythm and blood pressure. These medications work rapidly to stabilize the patient and limit the amount of damage caused by the blockage. In many cases, procedures such as angioplasty are performed, where a small balloon is used to open the blocked artery, often accompanied by a tiny metal mesh called a stent to keep the vessel open. This intervention allows blood to reach the heart muscle again, stopping further damage and improving the heart's ability to function. In more severe cases, bypass surgery may be necessary, where doctors create a new pathway for blood to flow around a blocked artery, giving the heart the oxygen it needs to continue pumping effectively. Treatment doesn't end when the immediate emergency is over. Ongoing care is equally vital. After the acute event, patients often follow a carefully structured rehabilitation plan that includes medications, lifestyle changes, and regular monitoring. Cardiac rehabilitation programs guide patients through safe exercise, nutrition adjustments, stress management, and education about heart health, all of which help prevent another heart attack in the future. Understanding treatment also means recognizing that recovery is both physical and emotional. Experiencing a heart attack can be frightening, leaving many people anxious or depressed, but addressing mental health is an important part of the healing process. Support from healthcare professionals, family, and friends provides reassurance and encouragement, reminding patients that while the heart has been through a serious event, it is also capable of healing and becoming stronger over time. Treatment, therefore, is not just about medicine or procedures. It is about restoring confidence, improving quality of life, and helping a person feel empowered to care for their heart going forward. Every aspect of treatment, from emergency intervention to long-term rehabilitation, is designed to give the patient the best chance at a full, healthy life. By understanding how treatment works and why it is essential to act quickly, you gain insight into the importance of awareness, responsiveness, and continued care. Heart attacks are serious, but they are also manageable when addressed with the right combination of urgency, medical expertise, and ongoing attention. As you absorb this, remember that treatment is not only about surviving a single event, it is about learning, adapting, and committing to protect your heart for the years ahead. Take this knowledge to heart, Act promptly if symptoms appear, and let it guide you toward a life where your heart is cared for, respected, and valued every day. As we come to the close of this discussion, it's important to pause and reflect on what we've learned, not with fear, but with a sense of care and responsibility for the life beating quietly inside your chest. The heart is more than just a muscle. It is the center of every memory, every emotion, every connection you have with the world around you. Understanding the risks, the causes, the symptoms, and the treatments is not about creating anxiety. It's about giving you the power to act, to notice, and to protect yourself in ways that truly matter. Life can be unpredictable, and while we cannot control every moment, we can choose how we respond to what we know. By paying attention to your body, making small but consistent healthy choices, and seeking help when something feels off, you honor the incredible resilience and importance of your heart. Remember, prevention, awareness, and timely treatment are gifts you give to yourself and to the people who care about you, because every heartbeat is a chance to continue sharing your life, your love, and your presence with the world. Take these lessons gently, carry them forward, and let them guide you toward a lifestyle that nurtures your heart, supports your well-being, and allows you to live fully and intentionally. Your heart has carried you this far, quietly working every second, and now it's your turn to care for it with the attention, respect, and love it deserves. Let this awareness be a quiet but powerful promise to yourself, to listen, to act, and to protect your life so that every heartbeat continues to tell the story of you in health, in strength, and in hope.